Right. Hey, thanks everyone for being here. This is exciting. I always love to do these. We are super excited to be teaming up with Scribble Vet. I know that there's a lot of players in the game, but we really think that they are doing things right. So this is supposed to be informative today, not salesy, right? We all believe that a good AI scribe can definitely be a game changer for your practice, and so I hope you can see some of those benefits today. I'm excited to introduce Dr. Kat Reardon. She's a Tucson-based veterinarian. She's got experience in general practice, feline medicine, behavioral medicine. She's currently the lead veterinarian at Scribble Vet, which is very exciting. And she's helping shape that future, kind of giving them the boots on the ground perspective. And she wants us to spend less time in notes, right? And more time caring for patients. I think it's also pretty cool that she is a medical illustrator. I don't know if we're going to talk about that, but I think it's pretty exciting. And so, Dr. Kat, please share all your knowledge with us.
Hi, good morning, or afternoon if you're on the East Coast. Uh, like Megan said, I've been working for Scribble Vet for a little while now. Started out with them when there wasn't an app yet, and I'm really excited to see the way that the company has grown and continues to grow. So I want to share a little bit about not just Scribble Vet, but like AI in general and how you can use that in your practice, because there's a lot happening in that space, right? So first of all, I just wanted to take a second to see if anybody feels brave yet in answering questions. I know it's hard when you're on a Zoom CE, but if anybody wants to share, like, what do you enjoy least about VetMed, or is there anything that you would bring up that you're like, if I could change that, I would. And you don't have to say it out loud. You can drop in the chat. I've got my colleague here, Karen, who works at Scribble Vet and is going to monitor the chat while I'm doing my presentation. So if you have something you want to say, just shout it out and she'll interrupt me. Difficult clients. I totally agree with that. Honestly, if I could wave a wand and make that stop. I like thought that curbside was going to solve that, and then it definitely didn't. Notes for phone calls. Yeah, absolutely. That's the biggest thing. I used to try to like type them in ahead of time and then make the phone call so that I would like kind of have a plan, but I don't know if that actually saved that much time. Notes, tracking down others for notes, unfinished notes. Absolutely. It's always embarrassing when like the referral hospital calls you and the front desk is like, hey, can we send that chart? And you're like, oh, actually, can you? Yeah, I guess go ahead. Staying late for complete notes. Yeah, absolutely. I was just reading this morning an article about how like Gen Zs and millennials like don't like to work late. And I was like, absolutely, I fit that. I fit that stereotype. I refuse to stay past 5 o'clock or 6 o'clock, depending on how late you're scheduled. Having medical records complete at the end of the day. Yeah, that's a huge struggle. So you guys mostly said it. This is kind of the word cloud that I came up with when I asked some people. And yeah, there's a lot that stresses us out in vet med. And so documentation just happens to be one of those things, and it's one of the easiest ones to fix. So that's what we kind of focus on. You guys know this already, right? You're like in the trenches. Vet med is really hard. It's a lot. And all of us got into it because we loved animals, and we found that it was more than just that. So that's the long and short of it. But part of it has to do with Neil trips on an angry chihuahua. Yeah. Part of it has to do with the fact that we spend so much time on this documentation, and it's not just like the time burden itself, it's also the mental capacity. Sorry, oh, that's my bird. I don't know if you can hear her, but she might say hello. It's also the mental capacity of keeping track of all this stuff, right? Like remembering at the end of the day, what was I doing at that appointment first thing in the morning? Which leg was it? Like how big was the mass? Which tooth was it? All those little things really add up, and it makes it hard to stay present and focused when you're in an appointment, right? So this is definitely contributing to one of the reasons that people in our profession are burning out, and we want to again address these things that we can fix. So we kind of talked about this already, but like the time that we're losing to records, like where is it going? Are we decreasing the number of appointments during the day? So are we seeing fewer patients? Are we staying late and giving up our personal time? Are we coming in on weekends? Like that's what I used to do. If I didn't finish charts, I would come in and like be working on a day that I wasn't paid. Yeah, exactly. That's the face. Um, so, like I do relief shifts in Tucson. So I get paid, between $1,200 and $1,500 for a 10-hour shift. And that works out to like $2 or more a minute. So if you're staying late for more than an hour, you're giving away, oh, hi, Theo, you're giving away like quite a bit of money. And so we kind of try to think about that the other way here because we're all kind of financially minded. And this is not tax advice because I am a doctor and I like I'm so bad at math. Making this slide gave me a headache. But if you think about how much you're paying for the average AI scribe, depending on the discounts you get, whether you're part of a professional group that gets you access, or your client's paying for it, whatever, we average it out about $300 a month. And if you think about what you're getting back in the time that you're going to save, like if you're spending 1 to 2 hours a day on those records, that adds up quite a bit. And so depending on your production rate and all those little factors, you could be netting about 6 times as much as you're spending for just the service of an AI scribe itself, let alone all the other things that AI can do for you in your workflow and the other ways that it can kind of save you time. So yeah, anyway, do you have anything to add to that, Megan? I hope I like mostly got the numbers right.
I'm the story girl, not the numbers girl, but this did come from the tax team, so we're all assuming it's right.
Okay. So, like I said, there's more than one way that using an AI scribe can benefit your practice. And I kind of wanted to just see right now if there's anybody that's using one already and kind of what they think about it, what they've noticed has changed for them. So feel free to, like I said, shout it out or drop it in the chat if you have anything to add to this. So anyway, while you're thinking, we do have some case studies at Scribble. People have been able to reduce their appointment times. So like I said, they can see more patients. You can maybe come more comfortable saying yes to some of those walk-in appointments. You can handle, maybe you have a tech out for the day and you're missing that labor. You may be able to kind of still maintain your sim quality of work without needing to cancel appointments. I implemented this in my last practice that I managed, and I was able to get my vets out on time and have them see more patients. So that's like a double win, right? Like I want everybody to go home on time and I want people to not be punished for extra productivity. So being able to get extra patients in is awesome. And then, yeah, that's another really good thing is it just helps me, like, instead of writing down, like, did I do those notes or not? There's systems in most of our AI scribes that let you check off, like I did that and now it's off my plate. I don't have to think about it anymore. Yeah, and teaching the students, exactly. Like I think as most of us have noticed, like this is not going away. So we're getting AI in all kinds of places, right? Like on our refrigerators, in our cars, on my Spotify, it's like trying to do playlists for me. And some of those things make sense and some of those things make less sense. But I think in our profession, it's really good to think about the ways we can leverage this so that it makes our life easier. And kind of gives us back the joy in vet med, which is what I've really found that it's done for me, honestly.
Dr. Kat, could you talk a little bit more
Yeah,
about like your experience in the room, like when you're handling patients, when you're talking with clients, like how that helps you when you're even just in practice or in the
yeah,
room?
yeah. It makes a big difference that if somebody is keeping track of what's happening for me, I don't have to be doing it. So I realized when I started using an AI scribe that I was keeping a mental list of like, what did I ask? What did they say that's notable that I'm going to have to remember to write down later? What did they say that I don't need to remember later? Yeah, which leg was it? Which tooth was it? And that was taking away a lot of my attention that I needed to actually instead be paying to the client and to the patient. So I actually find that I get bit less often since using an AI scribe because I've got both hands on the animal and I'm not like trying to scribble notes or like type with one hand. I used to try to get my notes done in the room. And so I was either not handling the patient or not making eye contact and kind of multitasking when I was talking to the client. And so clients really appreciate that I'm giving them more attention. And because I have to verbalize my exam findings, I'm actually communicating better with the clients. Like it isn't for their benefit, it's for the benefit of my notes. But like ultimately the end result is that like they hear more of what I see. And when I get to the end of the appointment and I'm like, oh yeah, by the way, I want to do a dental cleaning on your cat, they're not like, where did that come from? Because they heard me say earlier, oh yeah, we have X amount of dental disease. This tooth looks like it's got resorption. Da da da. So I mean, I really think that it's helped me in ways that I didn't realize that it was going to. I just thought it was going to only write my notes for me, and that was going to be great. But like, it's changed the way that I practice, honestly. And it makes me less stressed out. It just makes me like less reactive, like just like a better person to be around, honestly. So, okay, I just wanted to check to see. It sounds like some people have already used an AI scribe. So, like we were saying, AI is coming everywhere. So you may already have already have heard the term LLM. You may have used one of these products already. You may have used it and not realize that it's a form of AI, because it's kind of sneaking in everywhere. So I was just going to check to see also if you have one to add to this list. This is not an exhaustive list, so there may be something, an LLM that you've used that's not on here. But if we have any familiar with any of these things, you probably have seen them, right? So the image generation services are kind of cropping up, and there's a lot of conversation about, is AI art theft? There's the video and questions about deepfakes. So how do we understand where this stuff is coming from, basically, is what I want to tell you guys about. So like, what is an LLM? An LLM stands for large language model. So basically, like, the best way to think about it is like autocorrect on steroids. Because we're used to like typing on our phones, and it kind of knows, which word are you likely to select next. And that's basically on a fundamental level how this works. It's trained on patterns, just like your phone is trained on like what are the patterns and you usually use when you speak. It's trained on, like maybe they gave it academic papers, maybe it read Reddit, like whatever it is that it saw, that's where it's going to make decisions. And so basically what it does is it takes a bunch of words, it turns them into numbers, it does math on those numbers, it gets a result, and then it turns those back into words. So it's a big matrix math system, but basically it works kind of like a neuron to turn that input into an output based on those patterns. So why that's important is because it's kind of garbage in, garbage out. So like if you just feed it on, like Quora or Reddit or whatever nonsense is out there that's not peer reviewed, it's going to say things that are maybe not necessarily factual. And those have been termed AI hallucinations. And part of it also is just like, it may not be hallucinating, it may be pulling from information. That's just not correct. And so if you want this to work well, you need to train it carefully. So that's one thing to keep in mind when you're looking at these AI companies, and like things like the PIMs that are releasing their own, is like, how did this get trained? Like, where did this information come from? Did it come from peer-reviewed veterinary resources? Is it something that's a private model that's been tinkered with by veterinarians? Or is it just like ChatGPT and we slapped our branding over it and it's pulling from like who knows what on the internet? And so one of those things will save you time. And if you've ever used ChatGPT, like, it'll probably also save you some time, but you have to be really critical when you look at what it said. Like, I've seen, I've gone in and asked it to make discharges, just the plain old ChatGPT, and like it does about an 80% of a good job, but sometimes it just like pulls in stuff and you're like, what is this? I had a client that I was going back and forth with them recently about they should neuter their dog. And they were like, the internet said it'll give him cancer. And I was like, okay, what? Okay, show me. And she typed it into Google, and the little Google AI came up, and it was like, neutered dogs have an increased risk of testicular cancer. And I just sat there and I was like, does that make sense to you? Like, let's think about that. And she got really upset. But the point is that, like, if you just type things into the Google AI, you don't know where that stuff's coming from. So it may or may not be trustworthy.
The other thing I'll
Yeah.
add, when we
Yeah.
think about accuracy, is there's an element of precision as well that goes into it. So
Yeah.
you could probably test if type something into Google. It might get it right when you're looking at it for that one instance. But when you're thinking about a tool that you're adopting in your practice, like how often are you using veterinary specific terminology that doesn't necessarily exist in human medicine? How often are you using that terminology in your day to day when you're doing 10, 20 cases a day and you're using those terminologies like multiple times? Being precise and being consistent with that also matters a lot to make sure that your records are consistently accurate and not just accurate in a one-time instance. So it's something to also evaluate. Just, is this thing holding up when you're using it in practice?
Yeah, absolutely. Yeah, we don't want to hear like say the word Symbadol, and then because it's a Google model, it doesn't really know what that is. So it kind of reaches for the next closest thing, which is paracetamol, and now you've killed a cat. Like, you don't want that. So just real quick, I'm sure you guys can answer this question, but I just wanted to reinforce, like, why is it important that we know how these things work, basically? And it's because it matters what kind of result we're going to get when we use them. So feel free to drop the answer to this in the chat, or just like say it to yourself. You've probably seen this slide for enough because we've been talking a little bit. So an LLM doesn't just look up information or copy things that you already wrote. It predicts what should come next. And that's why we really spent a long time like training Scribble Vet in-house. Like that's something that I do as a lead veterinarian, is like literally go into the list of words that it knows and like be like, a snap test is a snap ELISA that works for, like heartworm, blah, blah, blah. So like if you have a human who's actually doing that, you're going to have more of that precision. So that's one of the things to look for. Other thing you want to look for when you're kind of evaluating these things is like, is it secure, right? Because if you're going to be saying things like, we don't have to worry as much about HIPAA, but we need to worry about client and private and patient privacy. So is it secure? The thing that Scribble that has is called SOC 2 compliance. We're not the only one that it has that, but basically what that means is it's like HIPAA, but for technology companies, and they come in and audit and they like try to break in and they do all these things to prove that like you're being careful with this information. So if you have questions about that, let me know. And then the other thing is like, obviously, if it's too hard, I'm not going to use it. Even if it works great, if it's a pain in the butt, like I'm not going to have time for that, especially if I'm trying to learn it while I'm going in between appointments, like no. So if it works for you, like that's really what I care about, is like find one that makes sense to your brain. Because when I look at some of the ones out there, I'm like, what is this? But that's also because I've been using Scribble Vet for so long, it just makes sense to me. So, just like some people are Apple users and some people are Microsoft users and they're very passionate about which one they like, neither one is necessarily better. Find one that you're going to integrate into your workflow and that's going to get you home on time, honestly. So I just want to show you real quick how it works, if you haven't seen an AI scribe before, because it kind of like we're probably used to seeing like the radiologists in vet school using Dragon and like fighting with it the whole time, and like we kind of picture dictation, which is not what this is doing. So I am gonna pull up Scribble on my phone real quick. Because first of all, does anybody want to do an appointment with me? I have my trusty Karen with me to do it if nobody volunteers. But if anybody has one that they just want to like go through really, really quickly as a demo, let me know. Okay, we're gonna use Karen then. I'm gonna show a different tab that has Scribble already open. Okay, you guys can see that. Cool. So this is what it looks like when I sign in. I have this existing appointment. I'm going to show you a little bit about that in a minute. And then we're going to go in and we're going to start an appointment for Potato. Go ahead and start it on my phone because my computer microphone is going to fight Zoom unless I put it somewhere else. So now I've started this recording and you can see that's all I have to do is just click this button right here and it's listening. And so it's going to listen to just the relevant information that we talk about in the exam. It's like an intelligent, like a technician scribe that's perfect. So it's going to listen to everything we say. It's going to pick out only the relevant information. It's going to write our SOAP for us. And we're going to get our notes back. And it usually takes like 3-ish minutes, sometimes a little bit longer. So we'll see. My internet has been weird lately. All right, so we're going to see today Potato. Potato is a 7-year-old female spayed. She's a mixed breed Mexican street dog. Potato's our Scribble Vet mascot. That's her in the background there. And she has a very complex medical history. She has had a history of UTIs, which is part of why the company got started. And it turns out recently we discovered that she has 2 vaginas. So that's why the UTIs are constant. But today we're going to see Potato for concerns about an ear infection. So what's going on with Potato that makes you think she's got an ear infection?
Yeah, so she's been scratching at her ears quite a bit, just looks really uncomfortable. She'll just suddenly
Oh,
stop and
sorry, Karen. I need to switch to my computer microphone. I realized that you're playing in my ear in this.
Sorry, we used a different microphone today because my computer one maybe isn't as loud as we like it. You can still hear me now, right?
Yeah.
Okay. So sorry. Tell me again why Potato's here today.
Yeah, so I've noticed in the past couple of days she's been shaking her head a lot and scratching at her ears. She just looks really uncomfortable. Suddenly she'll just sit down, shake her head really aggressively, and it just feels like she's more lethargic than usual. We did take her to the beach over the weekend, so I'm a little bit worried that maybe something got in her ears, looks uncomfortable. Um, so wanted to bring her in.
Okay. Yeah, it's not uncommon for dogs to get ear infections when they go swimming or go to the beach. Like if you get water down in there, that tends to cause that. So how about real quick, just like what is she eating? I'm just curious.
Yeah, so she's on Hill's sensitive skin and stomach. So gets about 2 cups a day.
Does she have a history of like allergies in the past?
Not too much. I do know that she like has a tendency, like in the past, she's like licked her paws quite a bit when she's kind of bored, and we had to kind of work through that, but it hasn't really been an issue recently.
Okay. Okay. So we're going to do a pretty abbreviated appointment. You guys know this is not a complete history, but at this point, let's pretend that I did a good job, and we're going to move on to the physical exam. The one thing about using an AI scribe is you do have to verbalize your physical exam findings because it can't see what you're doing. But like I said earlier, I think that makes me like a better communicator, a little bit more thorough doctor. We're going to look at Potato today, and it looks like her teeth look really good. You know, she's recently had a dental cleaning. Eyes look good. They're clear. I don't see any signs of like conjunctivitis. I do see that these ears look really red. So let's take a swab from the ears. And what I want to do is an ear cytology, see what's living in there. And then I can see that she's got some hair loss on her belly. And that's, you know, something that we've kind of thought about working up in the past. So maybe we'll schedule her for that abdominal ultrasound, look at those adrenal glands going forward at some point. We don't have to do that today though. And then the rest of her anatomy. Oh yeah, if you guys can hear Blue, sorry. At least she's not screaming. And then we can see, yeah, the rest of her anatomy is pretty abnormal. She's got this abnormal vaginal opening. So, you know, continue to see her specialists about that. But today we're going to address her, oh, there's the screaming. Today we're going to address her ear infection. So Karen, if it's okay, we're going to do that cytology, and then I'm going to go ahead and prescribe medication based on that cytology. But let's just assume that we're going to use trazodone just so we like know what it might cost. Does that sound like a good plan?
Yeah, that sounds good.
Okay, so we're going to stop my recording. Just like that. And then as you can see, I might have to refresh because my internet is being silly. As you can see, it knows that the recording is done. It's uploaded to the computer and the website. And all I have to do is hit this button to start getting my notes back. I can change the way that I want my notes to look. We have lots of different kinds of notes you can do, including, you know, surgery notes. But today we're just going to do the basic SOAP. And then we have that for Potato. And you can see like it wrote down already everything we said. But we're going to not see any of this irrelevant information when we get to the actual note itself. We're only going to see things like she eats Hill sensitive skin and stomach, and it already knows what that is. So like I said, it'll take probably between 30 seconds to a minute for normal appointments. For our, like I do an hour-long behavior appointment sometimes, and that might take closer to, I don't know, 3 to 5 minutes. But here we go, it's back. So you can see it pulled out the fast that she has this strange anatomy. We know that we had historical paw licking, and she's been more lethargic, and then she's been shaking her head. And then in our physical exam, it noticed that I called out that the ears were irritated. It has that abnormal vaginal opening. We have our alopecia, and I didn't say alopecia, right? I said like missing hair on her belly or something. So it knows not only kind of how to turn that into doctor speak, but also what are the anatomical definitions in terms of positioning. And if you don't say something out loud, like I don't think I said, oh yeah, her heart sounds good. So if you don't say something out loud, mine is set up right now to put in the normal findings. You can customize this as much as you want. So you could have it only write the abnormal findings in your physical exam. You could have it leave sections blank if you didn't explicitly say it out loud. And then you can have either yourself or the technician also capture vital signs, which can be really nice when you're trying to save some time. So another thing that it's going to do, it's going to write your full SOAP. So I have our assessment section here that's got my problem list. And again, mine is set up to suggest some differentials, even if I don't verbally say it, based on just like what are the common patterns, but yours doesn't have to do that. So I don't think I explicitly said otitis externa. It picked that out. And then it knew that we were kind of wondering if there was an allergic component to this. And then same thing with that ventral alopecia. It knows that that has been noticed in the past because I said that. And then I mentioned testing the adrenal glands, so it knows that endocrinopathy is a concern. One other thing that's really cool as a relief doctor is I can click this button and get some assistance if it's a complex case. And it's going to come with citations from Sophie from LifeLearn. So we'll talk a little bit about that in a minute, but it's like really cool. Moving on, we got our plans, we got our ear cytology. It knows that we're going to wait on our results, but we're probably going to do Trazodone. I love Trazodone. And then consideration of a demolition in the future. One other thing that saves me a lot of time is that it's going to automatically, for every appointment, write a summary for the client. And that's going to take everything you said and kind of restate it in a way that's hopefully maybe easier for the client to understand. So, for example, we have here, it says signs of inflammation, and it writes redness in parentheses in case they don't know what that means off the top of their head. And same thing here with the alopecia. So this is not something that you have to click an extra button to get or ask it to do specially. You can customize this as much as you want. So you can make this more in like the format of a discharge summary if you don't like it in the conversational emails format. But it can be really nice to hand to people, especially if, you just finished explaining everything for half an hour and now the husband is like, my wife's not here. Can you call her? And it's like, no, dude, I don't have time here. The other cool thing that kind of along those lines is we have this visual infographic that it can generate based on what the appointment was. This is going to change for every appointment. It does take a little bit because it's going to draw everything, like I said, customized by hand. I can close this and come back to it in a minute. And while that's happening, I'll just show you another example of an appointment here. And the only thing I'm going to do is update this because you can change your notes as many times as you want as you come back to them. So I'm going to say, okay, so we got the excisional biopsy results back, and the excisional biopsy, the histopathology showed that it was a reactive lymph node. So that's the third time now that we've ruled out lymphoma, but we need to schedule a CT. And then if I just hit Scribble on my phone, this is going to automatically update. And the phone and the computer talk to each other. So you can kind of go back and forth as you're coming in and out of appointments, which is really nice. And now if I wanted to call, Theo's my cat. I just had to go through this whole thing with him. If anybody has an idea about this, if anybody wants to consult on this case, you just let me know. But if I want to call Theo's mom now and let her know, okay, the histopathology was normal and I want that call documented, like, because I know that's a pain point. If I click this button right here, it will, oh, it's not set up. Oh, well, it will call the client and it will look like that's why, because I'm not in the Scribble Vet Animal Hospital. You can be in different practices. It'll call the client and it'll look like the call is coming from your hospital. So it spoofs your hospital's number. So, because we all did curbside, we knew people don't pick up unknown numbers. So spoof your hospital's number, you type in the client number, you hit call. You can do it on your cell phone or on your computer if you have like a headset or whatever. And then it records both sides of the conversation and documents them for you. So you do not have to worry about documenting client phone calls ever again. It's great for your CSRs, great for your techs, whoever it is that's doing that client communication. Now it's just like ready. As soon as they hang up the phone, they have a note they can copy paste into your PIMS and just like move on with their day and save, I don't know how much time. We only really have so far documented how much time the doctors save. But I imagine that the CSRs and the technicians are also getting a benefit from just not having to rehash all of those phone calls. The other thing that I kind of touched on briefly is the fact that you can switch between different practices. So like as a relief doctor, I really like that. And what that means is within your hospital itself, you can invite the CSRs and the technicians to also make accounts in your AI Scribe and have them using it for things like dentals, things like callbacks. So everybody can see each other's notes and everybody can keep track of what's going on. It can be nice if you just want to edit your notes in Scribble or in the web app for your AI Scribe and then have a technician copy and paste them once you've marked them as complete. Like somebody said earlier, you can kind of keep track here which appointments I'm done with. So like, all right, I'm done editing Potato's chart. Now it can be uploaded into the AI or into the PIMS by whoever is in charge of doing that, whether that's myself or one of the technicians. And then once I lock this as the doctor, other people can't edit it. So that's kind of nice. Speaking of Potato, let's return to this care card because I'm sure it's done by now. Here's that infographic I was describing earlier. like I said, these change for every kind of different appointment. But it's nice to give this to clients because they can take this 1-page summary of what happened home and like put this on the refrigerator or hand this to the partner or the children or whatever it is, so that they can kind of keep track of what's going on. Does anybody have questions about any of that? Cool. All right.
Hey, I have a question. So is it just a cut and paste application, or does it sync into, like we use Cornerstone here? Will it sync into the SOAP in Cornerstone?
So in Cornerstone, it won't yet. We're working on it. It does sync with a lot of the cloud-based PIMs. In Cornerstone, I use Cornerstone almost every day when I'm doing relief because it's really popular here in Tucson. And what I do is just copy and paste. It's not going to do like your little diagnosis codes, your bookmarks or whatever. If you're using a lot of those, obviously in Cornerstone, those are things you're still going to have to click yourself. That would be, if I had to make a complaint, my biggest complaint. But even if you're copying and pasting, it still only takes you an average of 2 to 6 seconds, depending on how quick you are. And if you are using a server-based PIMS, it may take 5 to 6 seconds to sync directly anyway. So it's probably equivocal. It just may save you the mental load of copying and pasting. But I don't mind it because it helps me keep track of like, okay, yes, I'm done with this chart. I ordered all the prescriptions. I also use that callback feature a lot to call pharmacies because then it documents, I don't have to write the prescription like 3 times in different places. It just documents exactly what I said to the pharmacist and which pharmacist I spoke to and when. So I really like that in terms of just like keeping track of stuff. So the short answer to that is like, it doesn't integrate with all the things. Karen just wrote the list of the ones that it does. And a lot of them, they're automatic, but even the ones that aren't automatic, it's still pretty quick. So I'm going to go back to my slides because I think we've seen everything so far in Scribble that we need to. We can always go back later if you guys want to see more stuff. We talked about this already briefly. One thing I didn't touch on is the fact that you can upload records into our program and a lot of the other AI scribes to get those records summarized for you. So whether you're the CSR that's kind of calling around and getting records, or you're the vet student that's job is to summarize the case, or you're seeing a referral, or you just don't remember what happened already, the AI can comb through hundreds of different PDFs and written records and all kinds of different forms to kind of make you a simple, easy to understand summary. Do people want to see that? Actually, I want to be sensitive of people's time and give kind of space for questions, but if that sounds interesting, I'm happy to demonstrate it.
Can you show an example, Dr. Kat? Because I think one thing to note is that one thing we were talking about earlier with AI and accuracy and hallucinations is that sometimes when you summarize documentations, if you give something to ChatGPT or have it to source things, you might find that it cites or makes up findings, and so you're not necessarily sure where that came from. Or perhaps you're looking at something in the summary and you're thinking, okay, great, I want to know a little bit more about a treatment that was done for this patient in the past, but I don't know which one of these 10s and 20 documents and which page it might come from. And so one thing that we've done with the record review, as we think about like, hey, how is this thing usable? How do we give people a sense that there is legitimacy in terms of where this information is coming from? You can look up HINA. I know HINA at least has some of the documents. We actually have a link where it will take you to the direct source in the documents that you've uploaded, and it will tell you, where we pulled these different pieces of information from so that you can cross-reference it for yourself and kind of see it coming from the source, and then be able to like quickly find more details about that patient if you need to.
So yeah, can you guys see? So if I click on Hina's records here where it says she's very sweet and friendly, here I click on this link, and here this page is among the documents that have been uploaded. Here's where it says that. So I don't have to like now go combing through if it's actually something that's important, like when did she get her Bordetella? I don't have to comb through a whole bunch of records to find that. Like here it is right here. And so that's really nice. I think someone has done a demo this morning, has changed the ones for potato. Since potato is such a complex case, she has like hundreds of pages. So that I would never read all the PDFs of potato's medical history, but it's really nice to just be able to see stuff at a glance. And so I can find kind of, what happened? When was this recommended? This is a while ago for Hina. So it's, like I said, great if you're a relief doctor, great if you're a multi-doctor practice, great if you're seeing referrals, because you don't have to spend all your day coming. And you can be 10, 20, 30 minutes of research, or you go into the appointment and you haven't done the research, and then they're like, oh, it's in the records, you didn't read them, and you're like, no, I didn't, I don't have time for that. Another cool thing is if I have a specific question and I don't want to even go through this whole summary, I can just be like, hey, tell me which vaccines are overdue. And then if there aren't any, it might get confused, but I can change the way that this is generated if I wanted to focus on a particular clinical problem or, answer a specific question. So that can be really nice to save you a lot of time. I don't think we need to wait for that to update. I think hopefully you guys take my word for it. I'm gonna go back to our slides. Okay, so we saw the record review, the LifeLearn citations I talked about a little bit. This is really nice. Like since it comes with the citations, basically, if you're wanting to add some support to your clinical reasoning, so that's something that happens where I live. The relief doctors often, say, I think this animal has fluted and this is why. And they put in like the VIN link or whatever. So this is great. I can just click this button and copy paste. And it saves me, again, that time researching. We talked about those care cards. Love those, especially for the complicated behavior cases. Like these are great. The one-click transfer, like I said, a lot of them, they're automatic. And the ones that aren't, honestly, my personal view is it's equivocal, having used it both ways. I don't necessarily prefer the automatic ones. It's nice, but it's not like game changer. So we were talking about the fact that, AI is coming in our lives in every single area, whether we like it or not. So people have lots of feelings about that. And we want to be transparent and upfront about the way that we're using our AI and kind of build, that's part of the client relationship is being transparent. And I'm so sorry that the bird is definitely on one this morning. She just got her birth control, so she's supposed to be calming down, but I don't know if it's working. So how do we talk to clients about that? Basically, I want my clients to know up front what I'm doing. So we have these signs that you can make in our app that you could put up everywhere that you would like to in your hospital to kind of just alert them right off the bat. I might also encourage people to put it in your consent to treat form, just add a little paragraph. Hey, by the way, we're going to use this AI scribe. This is why. By signing this consent to treat, you're consenting to participate. Depending on the state you're in, that may or may not be a legal requirement, but it's just polite. So we really recommend that you are kind of involving the clients in that conversation. And it's also recommended that you document the fact that they've consented to recording while you're in your appointment. So when you hit record, you can say, okay, I'm starting the recording. Thank you for consenting, or whatever it is. I'm going to use this for my medical records. Cool. Why is Potato here today? And if they don't want to be recorded, that's honestly not that big a deal, because you can just summarize the appointment as soon as you leave and you get most of the information. You can always have somebody there just in case that there's a discrepancy, but basically, you leave the appointment and you go, okay, we just saw Potato. Potato's mom says that she's been scratching her ears when she went to the beach. Her ears were red. Her belly was bald. You're doing your cytology, so you usually I can do that while I'm running from one appointment to the next, and it's not a huge deal. And along those lines, our anxieties about AI, I think they're valid in a lot of ways. And I think, it's important to be mindful about the ways that we use this technology. But in general, I don't think that it's necessarily a big threat to veterinary medicine, because robots are not able to perform surgery autonomously. They're not able to put their fingers in an animal's belly and feel, always tender in the cranial abdomen. And then like on top of that, the AI can't even pass a NAVLE. Like, honestly, when I was studying for the NAVLE, if you had just been like, here is the internet, like you can have access to it while you take this test, I wouldn't have needed to study. Like, that's all. If you have the information, like it's clear that the what they're missing is the decision making and the clinical instincts, whatever it is that humans can do. ChatGPT can't do it. So I think, honestly, I'm not personally terribly worried about AI taking over veterinary medicine. I think we need to be careful about the ways that our clients are utilizing it, right? And that's like a whole other conversation. But I think in the meantime, leveraging AI to get our lives back under control is really where we should start. So on that note, I really encourage you to take advantage of the benefits you get from being a member of Granite Peak. You get a discount on your Scribble if you choose to use us as your AI scribe. If you don't, we're not going to take it personally. Please feel free to email me with questions about using AI either way. My email is kat@chirocare, and you can reach me. But in the meantime, is there any other question that I can answer today? Or Blue. Blue can answer questions.
I'll ask questions for people that don't.
Okay.
Feel free though to interrupt me anytime, guys. What about for the people who say this is just going to take me longer? I can just type my notes faster.
I mean, I type like 120 to 160 words a minute. Like for me, the transcriptional burden wasn't that big a deal. It didn't make that big a difference. Like for me, it's the mental load that this is taking off my shoulders, and the fact that I can just breeze through my day and not think about notes, and then it's like 5:45 and I can sit down and be done by 6. So that I might have been able to do that if I like tried really hard earlier without this, but like it's just simpler to have that done for me.
I think there's also pieces of workflows that we couldn't really implement prior just because we didn't have time in the day. So for example, a personalized call with the client or a follow-up email detailing exactly what was discussed. That might be something that you've asked your technicians to take on, or it's just the thing that you'd like to take extra time in your day to sit down and explain to the client. And that now, even if you type quickly, you have a tool that can kind of enable you to do that for perhaps all of your clients. Or for example, if you're calling somebody and you go through the whole treatment plan with them and they say, "Oh, hey, do you mind I'm going to get my partner on the phone. Could you repeat yourself?" You can just say, "No, I'm going to send you a follow-up email. It details everything I just told you. Go ahead, and I don't need to repeat myself here and take the extra time for that." So there's a lot of areas where as you think about what AI can do, it's not just notes. And so like it's totally fine if you feel that you can type quickly and get your notes done. But as we think about what we can unlock with AI in this space, even just the record summarizer, for example, is an example of, hey, maybe you probably weren't going to spend 2 hours your day poring over the records of a single patient, but now you have the ability to quickly screen through a patient's case or records more thoroughly before you walk into the room. So as we see like where we have these functionalities that can be pulled out using AI tools, I think there'll be more of them. And so I think this is sort of the tip of the iceberg.
Yeah, and like one thing we didn't demonstrate right now is if I've uploaded records for a patient and then I open the same patient in my phone, when I go to start the appointment, there's already a little few sentence summary of what's going on with that patient. So I don't even necessarily need to sit down at a computer. I can be going from room to room and I'm just like opening potatoes, soap to start, and walk into the room and it's going to say, like history of UTIs, 2 vaginas, maybe has adrenal problems. So that's really nice because then the client's like, it's on the front of my brain, the tip of my tongue, and I walk in and it looks like I'm a genius because the clients are like, "Oh my God, how'd you know that?"
So I have a quick question. How do the patients get into ScribbleVet? Do we put them in there or does it download it from our software? How are those patients entered?
And some of the integrated PIMs, it can kind of talk back, but right now it's just like you're going to write it in yourself, which takes about 2 or 3 seconds. Usually what I am encountering now that I'm going to more practices that are using Scribble or different AI scribes is like the technicians have already entered the appointment because they've gone in and taken their history and they've recorded it. And now Like, again, I don't even have to talk to the technician. I can just look at what they already did and go into the room, and they don't necessarily have to come around me. So the appointments are in the cases where your hospital is using it, anybody can put them in for you. And in the cases like when I was using it by myself in hospitals, I would usually just go sit down at the beginning of the day and look at, okay, what's the schedule, and just put them all in. And so as I go throughout my day, it's like, oh, okay, I just saw Fluffy, I'm going to see, Brownie next. Okay, let's go.
And then do most clinics put it on their laptops, like the Scribble Vet app on their laptops, and then that's how their techs are using it?
Yeah, so the website you could pull in from any computer. So a lot of them, they have like a desktop or a laptop that's in the room. Some of them have dedicated iPads where they're carrying around an iPad. Like some clinics were already doing that, so they just download the Scribble app to the iPad. It works on Android. I use it on my iPhone because that's why it's just like always with me. And I also put it like on the table when I'm doing my exam, so it's a like visual signal. I'm not paying attention to my phone. I'm not touching my phone. I'm paying attention to you. And then we also have an Apple Watch app. So if you're like really on the go and you don't even want to touch a computer or phone, you can just like do it on your wrist, and then sit down at the end of the day. So there's a lot of different options. I even know of one or two vets that like make recordings on a little personal digital recorder, and you can upload audio recordings to the website if you want. So you don't even need to necessarily use a smart device. You can just kind of download those recordings and upload them later if you really want to.
Okay, so one more question, I'm sorry. So if we were going to get Scribble Vet, do we get it for the entire practice, and then multiple users could use that? It doesn't have to be on everybody's individual cell phone? Okay.
Correct. Yeah. And if you want it on people's cell phones, like I have it on my personal cell phone just because it's easier. But yeah, you could put it on desktops in the room. You could put it on laptops. You could put it on iPads. Yeah.
Okay, I'll keep asking. What about the people who tried to adopt the early ones, right? The microphone attached to the desktop computer that kind of flopped. How do we comfort them and say, like, this is okay to try again?
You get a free trial when you sign up. So I would say like there's really not a lot of risk to just trying it out. Like you're probably going to find that you really like it. And we have a lot of people that are like, I would never practice medicine without this. But it's not dictation. I think that's why a lot of us got frustrated with the microphone thing. Like I got really excited when those came out because I was like, I don't want to deal with typing. And you have to read it, chapters of a book, you have to train it, all this stuff. Like there's none of that. It is ready to go as soon as you download it. And I would say, yeah, just give it a shot. You can always compare too. Like if you're married to your dictation software, like do an appointment with your dictation software and do it with an AI scribe and compare and see like which one do you like better, which experience was better. And the same thing I recommend if you're kind of evaluating different AI scribes, use the same appointment. So like I said, you can download those audio files, upload the same exact appointment into all the ones that you're comparing, and then you can see like which one do I like better, which one do I use more comfortably, like which one can I customize the way I want. Because some of them, they're just all different. Yeah, it's like apples and oranges. Which PIMs are we linked with? Where did that list go? I honestly don't have them all memorized. Okay, it is Easy Vet, Pulse, DaySmart, Rhapsody, VetSpire, Shepherd, and Instinct. Oh, Karen beat me. Okay, well, you guys heard it out loud too. And then I saw a question about customer service. Oh, Karen got that one answered. Okay, good. Yeah, and like I love our customer service team. I think they're great. And if for some reason they can't answer your question, like I said, email me. Like I might be able to help you. And if I don't know the answer, I'll find the person who does. So here, I'll put my email in the chat just in case. Oh yeah, and then I guess since we're sitting here, the other cool thing to use it for is surgery notes. And like Megan was saying, those are the things that I illustrated myself. And I did some medical illustration in like vet school, so that's where this came from. I don't know if I have. Oh, is this one? Yeah, you can kind of see it on this slide here, the dental charts. So as you're speaking, it can write down your dental findings, and then it will make an image of either your cat's or your dog's mouth. We're working on horse dentals. And that image will change based on what you say to reflect the findings that you say in your surgery notes. So if you say that there's a lot of calculus-lide gingivitis, the teeth turn red and yellow. And basically it's nice because that way your assistant can actually focus on the anesthesia and the patient safety and not worry about like writing down all the things you said, like which one was it? What did you say? What did you mean? And like I've heard stories of people who like write it down on like a whiteboard and the whiteboard got erased, or there's all kinds of horror stories. So again, just kind of like trying to take over all the things that we can to keep your hands free and your attention on the patient. I think that's everyone's questions. Hopefully. Mary, you have another question? You're muted.
I did want to ask one other question. Sorry. So if we get the software, how do we cut and paste? Like we cut and paste it from the program into, because we use Cornerstone here. I mean, so just kind of walk through that. Yeah.
Yeah. I don't have Cornerstone on my laptop, so you'll have to forgive me, but I can definitely show you how that would work. Because I do this. The clinic that I work at most consistently as a relief vet uses Cornerstone. And like I said, I don't think it slows me down at all. So let's say I wanted to copy this into the note. Usually what I do is just, highlight it. And then if you're on a Apple computer, it's going to be Option C. If you're on a Windows computer, it's going to be Command C or Control C, excuse me. And if I do that, it's copied to my notepad. And then let's pretend that this text box is the PIMS, just to show you what that would look like. So now I'm in Cornerstone. There, it's pasted wherever I needed it to go. So to do that quickly, I hit Command V on a Mac, or I hit Control V on a desktop. The other thing that you can do is there is a whole copy all button right here, and I can decide which of these sections I want included in my copy all. I can decide how I want the text formatting. Cornerstone right now, it's not playing very nice with the text formatting. So if I do this, it's basically going to have little like asterisks next to the bold text. So if that bothers you, you can do this plain text. And then what I usually do, I usually don't copy my email to the client into my Cornerstone unless they ask me for it. So when I am copying, I usually unclick that one. Once I've done that, now it's going to be unclicked for all of my appointments. So if I want it back, I can go back in here and then I can hit copy all. It's on my clipboard. Now let's pretend I'm in the PIMS. There it is. So it takes me, maybe 2 seconds. I didn't time that exactly to make that happen. And then another really cool thing that I am happy about, because we kind of took a little bit to get this perfected, and now I really appreciate it. You can do multiple pets in one room. Sorry, I've done a lot of these. You can do multiple pets in one room. So let's say Potato and Theo show up together. Now their appointment is here, and it's going to know that there are 2 pets. So I'll just show you real quick. And if people need to drop off, they are welcome to do. Thank you so much for joining us. For anybody who wants to see this, I'm just going to show real quick what this would look like. So today we have Theo and Potato. Theo is a 13-year-old neutered male domestic short hair. Potato is a 7-year-old female spayed mixed breed canine. Theo is a feline. We're just going to start there, and we're going to just copy their appointments. So I don't need to do a whole appointment, but basically if you have 2 pets, all you have to do is say, their histories are going to be similar. And then if you say, okay, like Theo eats Hill's Science Diet, adult, whatever, and Potato eats Sensitive Skin and Stomach, it'll put those in their respective soaps.
You might have to scribble it as a soap, not format dictation.
Thank you for catching that. It'll put those in their respective histories, and then all I have to do is make sure I'm saying like, okay, I'm examining Potato now. Yeah, Potato's ears are kitschy. Okay, now I'm examining Theo. Yeah, Theo has some gingivitis. It will intelligently, just like a technician, listen and put each individual pet's information into the correct soap. This one might be a little weird because we didn't really like give it a lot of information besides their signalment, but I just kind of want to show you how this works real quick. The only complaint that I have about this that I think we're going to need to update is when I look up Theo, I want this appointment to be included, not just under his overall. So, we're always making improvements, but you can see it's done. And so now there's a copy all that I can just select Theo's result record, and there's a copy all that I can just select Potato's record. So again, all I have to do is click this button. Now I'm in Theo's cornerstone file, and I'm going to hit paste. There's Theo's soap, and then I can do the same thing for Potato. Does that make sense?
And one thing that some folks will do when they're working with different PIM systems is that they might create a template in their PIMs that is just one. It's like a Scribble soap in their PIMs that just has one text box so that they can just do a quick copy all and paste it in there. Of course, if you keep it in your respective sections, you can see next to the section headers, there's a little copy button on those yellow bars, so that it's like a little shortcut for doing the Command C that Dr. Cat was talking about. And then, of course, you can customize your Scribblevet templates to look a little bit more like the format that you have in your respective PIMs. So I know some folks in the history, they have preset fields for, vomiting, coughing, diarrhea, all of that. And so we can have those pre-headers preset in your history template so that when you copy it over, it looks like the format that you're used to having in your PIMs. So there's a lot of different ways you can play around and customize both on Scribblevet as well as your PIMs to make that transfer of notes easier. And then as the one-click transfer to the various PIM systems becomes online for like Cornerstone and other systems, some of that just becomes a little bit easier.
Yeah, we have a specific Scribblevet template at the Cornerstone Hospital that I work at frequently. And like Karen said, you just copy paste it all over. And since you can give it specific instructions to customize how your notes end up in Scribble, things like sign the notes as done by this doctor, as opposed to like having Cornerstone mark those things, or like using their Ava mark bookmarks and timestamps and things. Like you can kind of combine them in the Scribblevet web app so that you just have to copy it all over once and you're done. But yeah, what it won't do is for things like Shepherd or Cornerstone or Avamark or whoever, it's not going to put in your diagnosis codes. It's not going to do those extra, maybe you have to click the body systems in your little Avamark checkboxes. It's not going to do that for you. And so depending on, again, your PIMs, you can usually reduce or turn off a lot of those features if it bothers you, or your state is going to know if you wrote it down, that's in your notes account, so you don't necessarily have to worry about clicking all the little body systems ultimately, right? So you can kind of decide going forward how you want to integrate that into your workflow. Yeah, I've seen a lot of different variation.
Hey, this is a lot. This feels like a game changer for me. I'm not in practice, but this feels like a game changer, y'all. So I think we've got that one last question, Karen. I don't know, you're typing furiously to see if that pricing was GPA specific or not. This will be CE qualified. We're still waiting on the race approval board to wave their magic wand. If you guys need CE for this, please email us at events@granitepeakcpa.com and we will get that out to you just as soon as we get it. This will be recorded and saved on our YouTube, so you can share this with everyone who needs to see it and see what a wonderful addition this would be to your practice. Hey, that was the price without the discount, so even better, y'all. Tax savings. I just say things. Tax savings.
I mean, I think about it as like, if I save an hour in the entire month, it's paid for itself. Like that's the quick and dirty that I bring to it, is like, as long as I'm reducing an hour, and I'm doing that probably at least every day. So
yeah. Okay. Well, certainly appreciate you. Thanks everyone for joining. We'll see you again soon. Bye.